Hey. Hi, Dr. Darling. Thank you for agreeing to interview with me today.
My pleasure.
All right, why don't we walk? So, what's your pre-scrub ritual if you have one?
Well, it's interesting. I was a scrub when I was 15 in high school. So I was taught by a very diligent scrub head of nursing in Boston. And so I have a particular ritual of going through the exact process that she taught me 50 years ago, or more.
Okay. Wow. Okay. So coffee or no coffee before a case?
Just one cup of coffee.
That's it?
Yeah, I used to. It was funny when before I went to med school, I worked in a lab with Judah Faulkner. My job was to incise the cornea of a rabbit halfway through without any loops on it. And so I realized if I had more than one cup of coffee, my hands would shake. So I only had one cup of coffee.
Yeah, that'll do it. Yeah. What's the first thing you do when you walk into the OR?
Say hi to everybody. Make sure everybody's comfortable. Make everybody knows what we're doing. Make sure they feel part of the team. And if there's any questions, they can ask us right away so we don't have any confusion. You know, our cases tend to be fairly complex, and a lot of bad things happen quickly. So we want to make sure everybody's on the same page.
Okay. Do you listen to a specific genre of music in the OR?
I usually let the patient or the nurses pick the music. I listen to almost everything except for classic. I consider Jimi Hendrix classic as opposed to anything else. So I'll listen to almost anything, but classic rock's probably my favorite.
What's one non-medical skill that makes someone a better surgeon?
I think organized sports. You know, when you have organized sports, you're used to working with a team. You're used to having a structure, and you're there to make sure everybody works together. So I think that really helps you. And the hand-eye coordination is okay, but we can almost teach anybody anything.
Okay. What's your favorite thing to teach in the OR?
Anatomy and technique. And that goes along with physiology. But, you know, vascular is uses a lot of different skill sets. You know, not just hand-eye coordination, but there's a lot of angles involved and a lot of structures involved that you can damage. And it's important that everybody knows exactly where everything is in the three-dimensional anatomy. So I think that's my favorite to teach.
Okay. So what's something med students don't realize about vascular surgery?
Yeah, vascular surgery is one of the interesting fields, which is really surgery is a misnomer, because you know we treat patients. 80% of the people we treat we treat medically or observationally. So we do a lot. We're basically medicine doctors who do lots of varied procedures, either endovascular or open. So we operate from essentially the base of the skull to the tip of the toes. So we're complete doctors, and we're also complete interventionists. So it's a very varied field. So you never get bored.